The Wuhan virus may have damaged your lungs forever. Let me just repeat that. The Wuhan virus could have damaged your lungs forever. India's Vellore-based Christian Medical College carried out a study. What did it find? That COVID-19 impacts the lungs of Indians more as compared to Europeans or Chinese. And why is that, you ask? Was the virus racist? Of course not. So what explains the findings of the study? Let's just dig deeper. Now, by now, we all know that COVID-19 hit our lungs the hardest. Patients had dry cough, difficulty breathing. In severe cases, COVID-19 resulted in pneumonia, bronchitis, even acute respiratory failure. Pneumonia is when your lungs are inflamed, they are filled with fluid, and this makes it difficult for the person to breathe. Bronchitis is when your airways become narrow because of too much mucus, your chest is congested, and as a result, you start coughing. Acute respiratory distress syndrome, or ARDS, can be fatal. This is when pneumonia progresses, shortness of breath sets in, and the lungs fail. The person is put on life support. Many don't survive ARDS. Now, we have seen or heard of COVID-19 patients battling these stages of lung infection. Many died battling the severe infection. What about those who survived? What happened to their lungs? And the lungs of those who did not have severe COVID-19 or did not have to be hospitalized? There is evidence to believe that COVID-19 left some of our lungs severely damaged. When researchers studied CT scans of patients in China, they found fibrotic abnormalities in the lungs, meaning the lung tissues were showing signs of abnormalities. And when that happens, often the amount of oxygen entering our blood from the lungs gets impacted. And in this case, fibrotic abnormalities were setting in as early as 3 weeks following the onset of symptoms. This was irrespective of whether the patient had mild, moderate, or severe COVID-19. Scary, isn't it? Another study published in the European Respiratory Journal found that patients had abnormal lung function even 2 weeks after being discharged from the hospital, meaning COVID-19 continued to affect them. Now, what kind of abnormalities are we really talking about here? Reduced diffusion capacity, small airways obstruction. Now, here's what the study conducted in India is saying. For Indians, the lung situation was worse than the Chinese or Europeans. Again, why? Now, one of the theories is more Indians had comorbidities or other underlying diseases, you know, the likes of diabetes or hypertension. And here's another hard fact. For most of us who are breathing the polluted air in Delhi or Mumbai, our lungs are not exactly in their greatest shape anyway. But to point the finger at the exact cause of this disproportionate impact, we will need to read out some lines from the study. I'm quoting here. The difference in the impact of COVID-19 on different racial and ethnic groups is well described. Black, Hispanic, and AIAN people had experienced higher rates of COVID-19 infection and death compared to white people. It appears that our cohort of Indian subjects had more comorbidities and had more impairment of lung function than the European and Chinese patients. In addition, studies have shown that disparities in social determinants of health played a significant role in increased COVID-19 mortality, thus highlighting the social needs of low-income, low-education populations which impact equity in health outcomes, quote unquote. Now, what does this mean for those of you watching the show from India? It basically means that if you have been infected with COVID-19, then chances are the virus left you with lung damage. Could be lasting, could be temporary, could be minor, could also be major. Either way, the virus from China did damage your lung functioning in one way or the other. This India-based study observed 207 people. All of them were infected in the first wave of the Wuhan virus pandemic. They were told to take medical tests 2 months after recovery and rest. And what did the medical tests find? In 44% of the cases, the lungs' ability to transfer oxygen to the bloodstream was affected. 35% of the patients had restrictive lung defect. What does that mean? You see, when you breathe in, when you inhale, your lungs inflate, and when you breathe out, they deflate. But here, these people's lungs could not inflate freely. And mind you, this was 2 months after they had recovered from COVID-19. 2 months. On paper, they were supposed to be free of the disease, they were supposed to be healthy, but their lungs were secretly struggling. Their bodies were still struggling to breathe. Well, that's the Chinese virus for you. Technically, the pandemic is over, but chances are you and I are still secretly suffering. Look at what else the study found. 8.3% of the group had what's called obstructive lung defect. What's that? An obstructive lung defect interferes with the inflow and outflow of air to and from your lungs. And you know what's scarier? This study only took into account those who were infected during the first wave. We all know Delta was much, much stronger and deadlier. Imagine how that may have affected our lungs. And what does this tell you? The pandemic may be over on paper, but there is an epidemic of post-COVID complications. But who is paying attention to this health crisis? How many people are talking about how destructive long COVID is? How will you know if your lungs have been hit as well? Only your doctor can tell you that. But people battling long COVID often display brain fog, which means they have difficulty thinking, comprehending, concentrating. Your exercise capacity also is affected. In fact, the US Centers for Disease Control and Prevention also lists sleep problems, headache, pins and needles feelings, anxiety, and change in smell or taste as symptoms of long COVID. There is also tiredness, fatigue, fever, cough, difficulty breathing, chest pain, joint pain, changes in menstrual cycle. Again, something most women are not briefed about. You see, long COVID is not, and I repeat, is not limited to abnormalities in the lungs. There are different types of post-COVID complications out there. COVID-19 was a new virus. When this virus started spreading around the world, when it actually started jumping borders, when people started falling sick, no one really had any idea how to treat the people, how to cure patients from this virus. So the doctors started targeting symptoms. Patients were put on high-dose steroids. Who knows for sure how the patient's bodies actually reacted to the combination of a deadly novel virus and ultra-strong drugs. And believe me, even now, it may be too early to tell. COVID-19 was only detected in China in 2019, you see. At least that is what China tells us. And if we take that at face value, then this virus is just 5 years old. And to understand how viruses actually leave residual effects, we must look at another virus, another coronavirus that's been around for a while now. I'm talking about SARS-CoV-1. It was first reported in the year 2003 in Asia. The virus spread globally. One study of 71 healthcare workers affected by severe SARS found that even 15 years post-recovery, 36% of the patients had lung dysfunction. 15 years. And what are the different ways in which COVID-19 is likely to have affected us? There are cardiovascular issues. We've seen a spike of youngsters dying of heart attack in the last few years, in fact. Does that have anything to do with COVID-19? Doctors believe so. The Wuhan virus has also, in fact, left us with neurological changes, even gastrointestinal issues. These are things we will never know unless we actually start talking about them. And it is time to start addressing the destructive long COVID. WION now available in your country. Download the app now. Get all the updates on the move.